I'm so thankful for you, Mr. Chen. Thank you for joining us today. I'm going to do a brief intro and then we're going to get into this really robust conversation today. It's always a wonderful time having you here. And I want to say welcome to everyone. Today, we have the distinct privilege of speaking with a guest whose leadership and vision have left an indelible mark on national and regional development and definitely on my life. Please welcome Mr. Wayne Chen. Mr. Chen, it's an honor to have you here today, sir.
Good. The pleasure is mutual.
Thank you so much. Now, many persons know Mr. Chen as a businessman, as an attorney. He's been director for so many different organizations. We'll post them in the chat because believe me, it's many. We can start with Urban Development Corporation, National Land Agency, NCB, which is National Commercial Bank, representing 19 national employers associations as president of the Caribbean Employers Confederation. And most recently, chairman of the Southern Regional Health Authority. And it's from there that we're going to be, pulling a lot of questions out of you tonight, Mr. Chen. All right. I hope you can still hear me.
Hearing you loud and clear.
Awesome. Beautiful. So, Mr. Chen, let's jump right into it. Today, our topic is about common sense interventions for healthcare, elevating community wellness, the power of common sense interventions. And in our introduction, we mentioned that you're well known as a businessman per se. I don't know how many people realize that you're actually the chairman of the Southern Regional Health Authority. And so it's very interesting to me, and I want to find out from you how your business pragmatism shaped your approach to managing a public health system that faces so many constraints.
Well, I'm the board chairman, and what I really do is I support the managers in achieving mutually agreed targets that align with community, parish, regional, and national needs. So my role as I have developed over the many years, because I've been in business for over 40 years, all my life really, but running my own business since 1982. The approach is really around problem solving. It's around delivering on customer/client/consumer expectations. People may not like the comparison, but providing basic foods or providing basic services, whether it's financial services, whether it's logistics services, is really not much different from providing public healthcare services. You look at the need, you look at the people and the capacity to deliver, and you make them have the skills, have the tools, have the support that they can deliver efficiently. As it now stands, Jamaica has made a promise to its citizens to deliver universal, free healthcare, and to deliver this in what is essentially a poor country. A lot of Jamaicans will argue we are not a poor country, but their numbers don't lie. There are well-off Jamaicans, but there are also many Jamaicans who are not well-off. Certainly, you Jamaicans who live in the diaspora, and many of you are here and part of our family or wider Jamaican family, you will understand the material life that you will have in the United States or Canada or the UK or even other parts of the Caribbean. And when we go back to our home communities, realize that materially, a lot of Jamaicans, we just don't have the same material things, you know, the new car or the new house or whatever it is. And yet still, despite these things, we tend to have a life expectancy that's not much different in terms of years. And a quality of life that we might be materially poor in some areas, but we are blessed in others, psychically, psychologically, and so on. But I will never underestimate or downplay our need for good quality healthcare. And as I say, the state, the government, the country has made a promise to its citizens that it will be free to access. So it's not free, but those of us, there's nothing in life that's free, not even so good clean air and good sunshine. So it has to be paid for, and it's paid for by our taxes, plus all degrees paid for by, you know, those who pay some minimal fees in the system. It's paid for by contributions from local people of goodwill and of many individuals and organizations in the diaspora who contribute their time, their efforts, their resources, materials, money to make the system better. So I see my role, and I've been there since April 2016, but I will go even further back because I was at the head of the Friends of the Percy Junior Hospital, or some people will know it as a Spalding Hospital, going back 40 years. So long before this current role, I've been involved in different health institutions and health organizations in the parish and in the wider region. So I know many of these challenges intimately. After all, I have to access the system. My hundreds, if not thousands of workers, my friends, my community, my customers, all access the system. So knowing the communities, having a wide range of experience in business, a wide range of private sector experience, having worked in the food business, in distribution, in wholesale, in financial services. At one stage, we were by far the largest operators of remittances in the country. 20% of the Western Unions came from Super Plus back in 2008. So we can see it right across the spectrum in terms of the need. Given my own personal experience at the head of different organizations in different sectors, both rural and urban and regional, I lend that experience to bring efficiencies to the public health system.
Fantastic. Thank you so very much for that. My next question kind of touches on business side, because typically we look at healthcare as service delivery, and you coming from the business side, you just explained just how valuable the business experience is, and coupled with the fact that Jamaica made a promise to make healthcare free to its citizens. Therefore, the state is investing a lot into healthcare. So what is the expected return on investment? What are we hoping to see from the investment in healthcare like this?
At a very high level, we hope to see a healthy population. And how do we define a healthy population? We define a population with a higher life expectancy, lower infant mortality, lower incidence of treatable diseases, what we now call non-communicable diseases, and lower incidences of vector-borne diseases. So we expect to see less dengue. It's not well known, but Jamaica was an early country in terms of the elimination of malaria, the elimination of yellow fever. We joined the rest of the world in eliminating smallpox. We have very, very few cases these days of tuberculosis. It's not well known, but Jamaica lost significant numbers of people in different pandemics. The cholera pandemic of the mid-19th century killed more than 10% of the population of Jamaica. We don't have these issues anymore, but these issues have not disappeared in developing countries. So we have steadily moved the needle in Jamaica. It's not well known, but in 1962, when Jamaica became independent, average life expectancy was around 64 years and some months. Today, it is closer to 72 years, or it could be higher, but since the pandemic, I've noticed that we have leveled off a bit. So the point about healthcare, about universally accessible healthcare in Jamaica, is to improve these outcomes.
Yes.
And
All right.
business helps because we are driven by numbers.
Yes.
Numbers are unforgiving. The day our customers see us lose relevance, it's next, they move on to the next provider of those services. Unfortunately, public healthcare, we are the only game in town in terms of that. Of course, you know, those who can afford private access,
Right.
take the private or will fly out of Jamaica. But that's a very, 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 very small number of our citizens.
Right. I'm sure it's less than 1%.
It's less than 1% who can fly out.
Yes.
Yes.
Yes, absolutely. Okay, so with your experience and speaking about the socioeconomic differences in Jamaica, from an executive leadership perspective, what do you see as the most glaring opportunity for Jamaica or for the healthcare sector in Jamaica to shift what we see as inefficiencies and substandard levels of care in the healthcare sector?
Given the fact that Jamaica, as I said earlier, is a relatively poor country, we spend a small fraction per capita of what, say, the US spends, a very, very small percentage. But our healthcare personnel have that option of working in the US. So there is a sort of US wage expectation or some measure close, but the amount that is actually invested is much, much less. So there's a gap between the actual expenditure and the expectation of the skilled professionals who are expected to deliver. So that's the first hurdle that we have to overcome. So if we were to just slavishly model ourselves off the US or off any advanced country, we'd always be like a dog chasing its tail. We'd always be rushing to keep up, matching the reality of our resources with the expectations of the people who are charged to deliver and the people who are looking to get that benefit to access public healthcare. I think to do that, we have to not so much reset our expectations as to reorient how we view the state's role in making our population healthier. And here, I believe that we have to put a greater emphasis on primary health care, on keeping people healthy, on keeping people out of the hospital. I think it might be a controversial thing to say, and maybe not. But the fact is that there are certain, let me say, procedures, certain types of medication that are extremely expensive.
Yes.
The way the system is set up, there is advanced diagnostics, there are advanced medications for, say, the treatment of cancer and some specialized diseases that will cost hundreds of thousands of US dollars. Now, if we were to wait until people had cancer or wait until people have specialized diseases that would need this kind of intensive care or specialized diagnostic treatment or specialized medication, expensive specialized medication, Jamaica would never have the financial or the people resources to provide that care to more than a few people at a time. I think it's well known in Jamaica that we only have maybe 240 ICU beds. Now, when we say ICU bed and I speak to you as a healthcare professional, you know I'm not talking about a piece of furniture in a hospital room. We are talking about the whole support infrastructure.
Yes.
That will keep that bed going. These are highly specialized, and I'll say nursing personnel, because that is even scarcer than the doctors who provide the service. And you know that it takes many, many years of training, many years of active experience in an ICU, or and the attractiveness of going overseas, taking whole family overseas, is too much, and I can't fault someone for going overseas after having put in their many years of service in Jamaica. But
Yeah.
that will mean that we will always be struggling to provide more than a few dozen intensive care units in Jamaica. It would mean that we'll be struggling for many years to provide more than a few dozen expensive. You know that a good MRI machine costs several billion US dollars.
Yes.
Me bringing my business head and my empirical data-driven head to the situation says, if I had $1 million US to spend, would I spend it on a down payment for a new MRI machine? Or would I say, how many people can I touch with a community outreach
Yeah.
very early to promote healthier lifestyles or nutritional support at school or a mental health intervention at the community level? How many more people will be impacted positively than one MRI machine? And you know, you are very familiar with the concept of triage. In a
Yeah.
way, we have to look at our healthcare system and make some hard choices. But the fact is that moving the needle on mental health care at the community level is not as attractive and sexy and photo-operable as cutting a ribbon on a new $1 billion machine. So
Yeah.
it's a harder sell because it takes longer, it's not as visible, even if it has a much more profound impact on more lives.
Right.
Talk about Jamaica, we say Jamaica has an aging population, and we have to know things who are going to really care for elderly citizens, especially in deep rural where we don't have the resources to put them into a home, where people want to age and die in their own homes,
Right.
dispersed in a remote community. When do we pivot our public health system to train our community health aides in geriatric care? And not just to go and look in once in a while on the neighbors and the community, but to do it before. To go spend an hour reading, chatting to them, check the pantry to make sure there are things that there. We know, I mean, and I'm not afraid because I'm a senior citizen, to say, make sure there are pull-ups in the house, whatever it is, to make
Yeah.
sure that elderly Jamaicans in the twilight of the years can live a decent and respectful life.
Yes.
That is the sort of national conversation we ought to have. And I will stand up publicly anywhere and say, if I have a choice between that expensive piece of diagnostic equipment or that fancy new thing in a hospital versus making 100 elderly or 200 elderly live better, my answer will always be the latter.
Okay. You know, I was just thinking a couple of years ago, I read a research that demonstrated that 90% of healthcare expenditure is in the last 4 days of a person's life.
Absolutely. You're squaring with what I see in the empirical data.
Yes.
If
Yeah.
we can step back from it and not just say, oh, it is what it is, and this is what people are used to, and the structure is already there. If we have the luxury of stepping back, and I think we do, if we collectively have that conversation and foment the will to do it, step back and say, these are the limited resources we have. This is the financial resources, these are the people resources. But there's a great thing in Jamaica that we tend not to pull together, and that is the goodwill resource. And there's a lot more community goodwill than we think is out there. But it is in pockets. I mean, when I say it's in pockets, the person who organizes the local youth club to play football or play dominoes or play cricket, the local community leader who organizes the Labor Day cleanup, the ones who are in church and they volunteer to have an outreach on special days for the elderly and they put together the food packages. Why aren't we coordinating all that group? And there are a lot of people who want to give, but the structure is not there for them to give it effectively.
Yeah.
We have to step back and we have to think, how do we mobilize communities? Not just paid public health nurses and paid community health aides and paid vector workers. What about community organizing around how do we, in an aging population in communities where all the young people have gone to the city or gone overseas, how do we pull together to ensure that the elderly are not neglected or left behind? How do we pull together to make sure that people are living well? Where is not just the youthful football team, but where is the community walking group in the evening that everybody is walking? And everybody is saying, you know, we're going to cut out the sugary soda, we're going to cut out the sugary juices, and cut out the salty food. And we're going to create in the community spaces some callaloo bed or some community food patches, even in the cities. I'm a big
Yeah.
proponent of urban gardening. And I think wellness is more than just, as I say, not drinking sugary drinks or not eating salty food or fatty food. But where is the urban garden? Where is the community garden? Where is the community bed of vegetables and herbs and so on? So we're not just eating processed food. Where's the
Right.
question about wellness? Where's the community walking group and exercise group? Where's
Yeah.
the park where you have the public, the calisthenic devices? I see them in many Asian countries. I just don't see them in this side of the world yet.
Yes. Well, the community that I live in Florida, any direction you go, there's a park with exercise machines set up in them, not just walking trails or running trails. And so that is really one of the things I would love to see in Jamaica. And I know Jamaica was just hit with a hurricane that has wiped out some of the capabilities of the healthcare system to deliver care into deep rural areas like where I came from, Silo, St. Elizabeth. And once again, thank you so much for coming and being a part of the healthcare conference that we bravely took to St. Elizabeth. And so, you've been just giving us a lot of examples of ways in which the community can help themselves in terms of organizing, just thinking about the needs of the elderly and making sure that they are met. But as you said, organization is necessary. So I'm going to ask you this question anyways. In your experience, is there any low cost way that the government can use to help to institute some of these things that you're talking about, like the wellness checks for the elderly, somewhere we can start?
I personally believe that when I say that we have to foment the will to reorient public health, it starts at the community level, because one thing about the political directorate, and I may get bashed by ministers and governments for saying this, is that
They have to pass through me.
they count votes. When a community calls for better roads, you're surprised that their road gets fixed first. But they count votes. If a community has 10 people, it's not going to get its roads fixed as much as a community with 100 people making noise. I think if our communities organize themselves and take some of the responsibility partially down, and they say, look, this is our health center. We won't every day get on a thing and travel to Mandeville or travel to Black River or travel to Maypen. We'll come to the community, the health center, but this is what we want in the health center. We want a doctor to visit us once a week. We want, if a doctor is not there, we want to be able to go to the nurse and say, nurse, put me on the video screen and get that doctor, wherever the doctor is on the other end. And the nurse is able to take up her phone or her camera or whatever it is and say, oh, there's a rash on the skin, or this is the color in my eye, or do an interview. So more diagnostic services, more counseling is available by telemedicine or whatever it is. But we have to know what to ask for. And it's not beyond our capability or nor beyond our resources to provide these things. But they come more quickly, I'll tell you, when communities are well organized and ask for them. Because getting structures, a healthcare structure, a public healthcare structure that we inherited at the time of independence, that we made significant contributions to designing. In fact, the Jamaican, let me put it this way, the network of sentinel sites of health centers, over 300 in the country. That model was actually adopted for the rest of the world, for developing countries. A delegation of Jamaicans went, I believe, it would have been in the late 90s, might have been in the late 1970s, to a conference in the Soviet Union and offered this model. And the fact is that there are many universally accepted models of healthcare that were actually developed in Jamaica. So it's not beyond our ability in Jamaica to innovate and to come up with new things. Where we have had a challenge oftentimes is scaling them up and making them universally and consistently delivered in Jamaica. And the fact is that when we have made this promise of universal healthcare, not even the United States promises that, you know, in America, if you're not insured, you take your chances. We don't have that in Jamaica. But what in Jamaica is overcrowding in hospitals, a shortage in terms of some specialized services and so on and so forth. But we need to keep people out of the hospitals. And if we're going to keep people out of the hospitals, we're going to have to look at the demographics, what are the vulnerable groups, what are the emerging challenges. One of the challenges that I'll be the first to say we are not meeting is the challenge of mental health. Of the illnesses that manifest physically actually have their root in a lack of mental wellness.
Yeah.
We are a country that suffers, many of us suffer from post-traumatic stress disorder.
Yes.
Poverty has been linked to PTSD. A child who doesn't know where the next meal is coming from may be suffering from PTSD. A child who lives in a violent community or has witnessed an act of violence is suffering from PTSD, but we are not treating these children and they carry through life. Many of our children suffer from undiagnosed learning disorders. Many of them are on the ADHD, on the spectrum for other things, but we don't have the early intervention, so they carry it through school, almost like a stigma that so I'm not doing well, and it manifests later in life in other things, in antisocial behavior, in underperformance, underachievement, which eventually ends up in our public healthcare system in some form or another. Whether it's that young man who got his first bike and is wheeling and ends up in the Black River emergency room on a Friday night with a broken back or a cracked skull. It started somewhere.
Yeah.
And going back to my original thought, if we step back from the issue and we say, let us deal with low-cost early interventions, healthcare as we know it would look significantly different. But it cannot be just the responsibility of the public health nurse or the visiting doctor or the community health aide or the vector control worker. This is where now public education and resocialization is a bigger role. This is now where individuals take some more responsibility for their own outcomes. And that is in responsible behavior, better parenting. I'll share this with you because I recently read a study. And, you know, again, it was something that was discovered in Jamaica and we have never really rolled it out. There was a study, and it was a long-term study over 20 or 30 years. It had 3 groups, and it was a parenting study.
Okay.
They had a group, and it was essentially parents from a low income, mothers from a low income background. I'm being very generalized, and you can take it up with me if I get the name of it wrong. But basically, they discovered that a mother who just speaks to her child, stimulates, looks a child in the eye, versus one who doesn't, the outcome after 20 years is completely different.
Wow.
Right. It might sound very commonplace and basic for us that, oh, you have a kid, you're going to play with it, and so on and so forth. Would you believe that there are babies in Jamaica that don't get that early stimulation?
Oh, wow.
So you're coming back to your question because I haven't dodged your question. Are there low cost or no cost interventions that we can know?
Yeah.
I have long believed, and it's something that I have championed. I've gone to the different ministers of education, I've gone to the Governor General, I've gone to prime ministers, leaders of the opposition, and say we need to focus on parenting skills because many of the things that we see that manifest later, poor health outcomes, rising NCPs, and unacceptably high level of violence in our society, even with reduction, is still unacceptably high. And the rooted in the very, very thing. So when I heard about this study a few weeks ago, I said, there we go. We keep saying the same thing over and over. What some of us know, that we have to, what we take for granted as parenting skills are not innate.
Yeah.
Parenting skills are learned. And they are weakened over generations if people are poorly parenting. And this is not a moral judgment. This is
Yeah.
me saying that there are many babies in this country now who do not have a mother looking them in the eye and making the goo sound and talking to them and stimulating them from day one. And it plays out negatively in year 20, year 30, year 40 going on in terms of underachievement, underdevelopment. And I'm not saying it's preordained, but the data has shown that we need to do better at that stage.
Yes. You know, it reminds me of a conversation I had a few weeks ago with this young lady. Her name is Susan Beadle, who actually, during her master's program, did a study on, well, her topic is a mother's love with a question mark. And what she was exploring is how the way a child is treated by the mother specifically plays out in adulthood. And so, you know, hoping that, you know, that conversation will open up. And there's a young lady that I was speaking with in Jamaica. She's pregnant. And I asked her about, you know, like parenting classes. And she's like looking at me like, what are you talking about? I said, haven't you been to parenting classes, you and your husband? And it was like, you know, she can barely get an appointment with the doctor or the clinic. You know, I was like, okay, that's an opportunity there for us. So I do agree with you very much. And so we've been talking about primary health care a lot. And of course, the Black River Hospital, you know, has been very damaged, and we know it's going to take years before a tertiary hospital is constructed again. And so right now, shifting, I know that, you know, birth to 7 years critical, and we really need to go there. But during the healthcare conference, we had doctors and dentists come to Silo, and there are some persons who were there who, even now, I'm getting texts saying thank you for getting persons to Silo. You know, some of their needs are met. And we also brought a naturopathic physician, and they, you know, they were doing some assessments, etc. But, you know, naturopathic interventions take long for you to see results. And with persons who in St. Elizabeth, who know their closest hospital in Manchester. So there are clinics in the area, but I don't really have a grasp as to the capacity and the capabilities of the clinics there. So what would you share with a person who has a known illness to do right now in terms of helping themselves from a primary care perspective to prevent, say, a relapse in their disease, or in terms of getting access to the hospital? There are so many questions rolling around in my head right now. I don't even know how to present it to you, but this is a scenario. Somebody is in Silo, St. Elizabeth. It's like an hour and 15 minutes with the roads to get to Mandeville Hospital. What would you say to a community like Silo in a time like this that they can do as a preventive measure from an adverse event because of access?
The first thing everyone needs to do, and it comes back again to what I was saying about individuals have to take charge of their own health, because nobody's going to do that for you. The first thing everyone should do is get a comprehensive checkup and do that regularly, at least once per annum. We have a very high incidence of diabetes, just to use an example, in Jamaica. Some of it is genetic and very hereditary. Some of it is lifestyle based, that mixture of the two. we have an inordinate percentage of people who die from cancer, from strokes, from heart disease. Many of these are lifestyle linked. So the first thing you have to do is get a diagnostic test. The government, the Ministry of Health, over the last 2 years, had a massive Know Your Numbers campaign. There literally was a roadshow that went right through the island. Hundreds of thousands of persons were checked. Blood pressure, heart rate, in some instances even body mass and weight ranges and so on. It wasn't something just nice to do once. It was to really bring people up to speed. Doing two things, doing the diagnostic tests and giving people a benchmark by which to measure their own healthfulness. But if you were to ask me how many people have taken the results of their personal tests, firstly, how many people have taken tests? When I last checked, it was a couple of 100,000. But if somebody was to say what percentage of adult Jamaicans went and had their numbers checked, I would say it was significantly below half. So assumption would be either people are already aware or people were not interested. It's one of the two. There's some amount of indifference because there's a huge amount of publicity around it. And as I say, it went all over the country. A roadshow went many corners of the country. Plus, many of these tests are available in many of the health centers. They might not be available every day, but it's on a rotating basis that most health centers will have a day or two in a month when these tests are available. So the first thing I would say is understand when you can get tested at your health center for the basic things. Start a health record, open your own file, and follow the advice. The public health nurse is there, the community health aid is there. There's a lot of literature. There's a lot of learning online. If you go to the ministry website and the different links, there's literature to read. It is well known that there are more smartphones in Jamaica than there are humans. We can't only use our smartphones to WhatsApp the latest gossip or to look at the latest TikTok. We have to also make ourselves much more conscious around the choices that we make for a healthier lifestyle. It's not a mystery that healthy outcomes are linked around three things. It's going to be linked around your diet, it's going to be linked around your level of physical activity, and it's going to be linked, third thing, to the quality of sleep that you get, how you manage stress, and so on and so forth. It's not that we don't know these things, but here is where, as I said, my redesigned public health system, because I don't believe that the state has to play a kind of mommy daddy. People say in the UK, in the early days of public health care, they call it a nanny state. Some people call it paternalism or benevolent dictatorship. I believe that, the public health system has to more than just passively say, hey, you guys have to take charge of your health. We have to be much more effective in our messaging, much more effective in making sure that people do take charge. Because I can sit down with you and we both know, hey, you should be walking 10,000 steps a day, or as we age, we should be doing some more weight training. We should cut back on the alcohol. Certainly, we shouldn't be smoking. And let me tell you, the campaign against smoking tobacco, and let me be specific, has been one of the more successful health campaigns in Jamaica. Because tobacco consumption in Jamaica has fallen steadily over the many years, and that has benefited. But we have not seen a similar campaign around smoking, the other thing that Jamaicans like to smoke and smoke in greater quantities. Because everybody says it's a natural thing and it's not harmful and so on. But let me be blunt, and I don't think we have been doing it because it's not fashionable to say it. Putting smoke into your lungs is never a good idea. It's just not a good idea. It's going to have an impact on you, when you get emphysema later and you're coughing and so on and so forth. Nobody was there saying, boy, this is natural things. You have to make choices. I don't mind, if you want to boil a little green tea and so on, but smoking will have an impact, a negative impact. And I don't see it often enough in our health messaging. It's just not fashionable and nobody wants to say it. I remember there was a former CMO, Dr. Delahaye, who cautioned, because as a psychiatrist in his practice, and he said it nationally, and a lot of people poo-pooing, that there is a link between marijuana consumption and an increase in certain types of psychoses. We don't want to say it.
Ah,
All for legalizing it, but there must be responsible use, and we must understand that everything in excess is not good. Nothing in excess is never going to be good. You can't say it's natural and it's God's thing and this and that. No, we must practice restraint and healthy lifestyles. And if I'm going to go on and on about healthy lifestyles, the hospital must be a last resort. It cannot be the first resort. And that being said, I know we want to talk too about how we're going to better equip the hospitals, give the healthcare professionals the tools, and so on and so forth. So I want to preempt you and say, here is where management matters.
yeah.
Here is where using the latest AI, we use AI for data analytics to better deploy resources.
Yeah.
Where telemedicine becomes critical. I just said that my vision is that every health center, certainly in my region and eventually in Jamaica, has robust internet.
Yeah.
I remember going back 2 years, we started putting Starlink in the health centers, indeed rural, because if we had to wait on the traditional cable providers, one, it's a very torturous procurement process. Two, it's very costly. And three, when the technology exists that we can put an antenna on the roof of the health center, and the staff are happy because they can WhatsApp and they can keep in touch with their friends and families while they are at work. They can do consultations. The patient, suddenly waiting time is not an issue anymore, because when you sit in the health center, you have internet and you can do all the things you like to do and not pay for it.
Yeah.
Putting internet, robust internet into all our health facilities is one of my goals, because everybody likes it, everybody comes out ahead, and it actually becomes a good diagnostic and messaging tool, because as you sit here now, the health messaging becomes people. You can say, hey, watch this video, or hey, go on this site, hey, watch this TikTok. It's just for us to get better at messaging that actually resonates with our different stakeholders or different potential patients. You know that if it's on Facebook, the young people are not going to see it. So
or I'm learning about TikTok now.
if there's anything that is going to require more than 2 minutes of reading, it's not going to get ready.
You're going to lose your audience.
The most effective medium in Jamaica right now is short videos.
Yes.
So
yes.
I will ask a rhetorical question. Is the regional authority and the Ministry of Health and all the public healthcare providers, are we making enough informative short videos? And the answer is that, there's nice stuff, we own the health center, or we did this, or we did that.
Yes.
But where are the short videos? Really, in a very effective way, promoting healthier choices.
Yes. Yeah, I would like to get back a little bit to what you spoke about, the 3 things that are necessary for good health: or diet, or level of activity, and what was the third one?
How we manage sleep.
Sleep.
Especially the fourth, because all 3 to come to how to manage stress. But sleep, we don't pay enough attention to sleep.
I wanted you to repeat that specifically, sleep, because there is a law in Jamaica about noise pollution. And I would like the powers that be to drive into my community at night and hear the music. Sometimes I call my mother and she'd say, oh, I had a hard night last night. Why? Because of this. So she's not, and my mother is old. Right? So
I'm not gonna ask.
So that brings me to the question, and I really wanted to say this, so let me say it. Thanks for being blunt about smoking.
So many things I would say are going to be unpopular. If I say that all of these loud music, fine if you're in a soundproof room and people want to get deaf, even though I would caution against that because that has other issues. But I don't think we have the right to disturb our neighbor, certainly not past a certain hour. If we say at 11 o'clock all systems will close off, I think we'll strike a balance. Those people who want to disturb the neighbor and turn off the bass to whatever volume. But I think after 11, to keep people up is unconscionable and should be banned by law. I would say it and defend it.
It is banned by law, but it's not enforced.
Oh, well, there is a night noises law, and we have to enforce the law.
Yes. So in that, what are your views on intersectoral collaboration? For example, in terms of health, as we're talking about, we just looked at the legal side. And for many of the parts of the discussion we've had so far, we've looked at the financial side. Okay. We've also looked at the social side because we're talking about manifestations of health and also determinants of health, which is, poverty level, etc. How do we get the different sectors together for them to understand that healthcare cannot be addressed in silo?
Silos and silo. I'll tell you this. I've been privileged to know every prime minister in Jamaica since the 1980s. Know in the sense that we have sat down and had long conversations.
Yeah.
And every single one, regardless of what political party they have belonged to, have lamented the lack of joined up government in Jamaica. And I can tell you that they have been trying for a very, very long time. I had the privilege back in the early 1990s to actually go to a retreat with the then Prime Minister and the then leader of the opposition, cabinet, heads of government, and it wasn't more than maybe 2 or 3 dozen of us in the room. And that was a big part of the topic, how to get the different arms of government to work seamlessly together. And that was over 30 years ago. We have gotten a little better at it, but not anywhere near where we ought. When we look at the arms of the state, and I'll put it this way, every citizen is going to, at some point, interact with the agencies of the Ministry of Education, and by that I mean our schools.
Yes.
We are going to interact with the parts of the Ministry of Health. And it's not a coincidence that those 2 ministries get the biggest budgets, because they are where all of us are going to end up at some point. Whether in school, all of us, in the health or the hospital, 90% of us, and so on and so forth. But if you were to look at the state with its $1 trillion budget and its 100,000 plus public servants, I would step back and say, but there's some duplication of effort. There's a lot of resources that are over here. The Ministry of National Security might have social workers to help the community organizing. There's a Social Development Commission. There's a Ministry of Labor that is doing some poor relief and is responsible for the social safety net, big parts of it. If I am running a business, the first thing we're going to say is, how do we consolidate all of these around wellness?
Yeah.
Because if I say, Kerry, I believe people should be moving more. And when I travel in the countries where people are living close to 90 on average, the average life expectancy in some of the East Asian countries is 90. A third of the people that are alive in Japan today will live past 100.
Yeah.
But when you go to these countries and you go to the parks, you see the old people, the elderly, they're exercising in the park.
Yeah.
Big heavy weights, but they're doing their Tai Chi and their yoga and they're doing this and that. And it may well be a social worker who is organizing the class and everybody comes out, but it's serving several functions.
Yeah.
We know that the quality of life is not just about physical wellness, but it's also about mental and psychological wellness. Psychological wellness is that sense of community, the interaction. When you're ailing and you're shut in and nobody comes to visit you, that's a very poor quality of life.
Yes.
So when we have these discussions now, we organize in this way. So coming back now to getting the arms of the state to work together. This is now where, when you have your parish development committee and all the different people sit down and the police talk about the police community, the community policing, and the SPC talk about their organizing, and the JCDC people talk about finding the talented ones that want to sing at festival or dance at festival or whatever it is. And schools which have huge resources, when I say huge resources, they all say they are strapped, but education gets the biggest chunk of the budget. There is a coordination of the effort. Where is one of the things I would love to see, and I'm now interacting with the Ministry of Education also, But where I see the interface, where is the guidance counselor, community health aide, the public health nurse, and the social workers? Where is the collaboration now to make sure that the efforts are coordinated?
Yes.
Where is the guidance counselor, or nowadays, they have things that didn't exist in our time, the dean of discipline. It's really unfortunate when we, we reach a stage where there's somebody in the school responsible to maintain order.
Yes.
Yeah. Hope that one day we can make that. I'm not saying we must abolish the role, but we must make the role irrelevant, because we all become, in our way, not so much deans of discipline, but stewards of positive behavior. Let me put it that way. So, yes, there is a role. It's difficult the way government is currently structured. And I'll say it because in my young years, and this is why partially I've tried to serve in different arms of government, is to better understand how the different pieces work. I remember years ago, in my early days in business, and I won't call out the names of the people, but I realized that by the time the end of the year and early in the new year would come, the government offices would come and suddenly they would have long shopping lists, and they would want extra coffee, and they would want extra this and that. All the things that they would normally buy on a rolling basis, whether to provide a little lunchtime break or refreshments for the staff and so on. And I said, why is there a sudden rush in spending?
Right.
Person said to me, you don't know about use it or lose it. I said, what do you mean? I said, if we don't use our budget, they're going to cut our budget next year. And
Wow.
And this is 50 years ago, and I'm saying,
Yes.
I'm saying that can't be the best way to operate the public sector. You follow me? But over the years, coming back to your term about silo, people operate in silos, and I can't blame them. They get a task, they get a work, they get a job. They are going to do their job within the guardrails, the guidelines, the rules, because nobody ever got chided, punished, sanctioned for staying within their boundaries. But oftentimes they stray out of their boundary to say, I'm going to take on some of what the other person is doing. That is becomes very easy. We have not created a structure that encourages collaboration. Let me put it that way.
Do you know what it's going to take?
It's going to take, there's something I discovered in the last couple of decades. It's something called social dialogue. It's not just a nice thing. It's something that has actually worked for Jamaica's benefit. On one of my hats, I sit on something called the Labor Advisory Council, LAC, which is a social dialogue tripartite body that sits at the Ministry of Education. Ministry of Labor.
Yeah.
And this is where the business leaders, the leaders of the union, and the government come together to make policy. Because the way the United Nations, through its arm, the International Labour Organization, the ILO, the United Nations, and our multilateral donors promote tripartism. In other words, they don't just listen to what government says. They want to hear the private sector, and they want to hear from the leaders of labor. In other words, the workers.
Yeah.
Social dialogue, but social dialogue has evolved over the years to be a bit more. It is where, you know what you hear, the common term you hear in Jamaica nowadays? Stakeholder consultation.
Yeah.
You never heard such a thing 30 years ago,
No.
It's social dialogue playing out. But here is the thing. Here's the thing. You remember I started by saying communities must get organized?
Yes.
And I say it here, and they can come at most of these stakeholder consultations are just box ticking exercises. In other words, the ministries, the agencies that are charged to do stakeholder consultation might have a little town crier, they might do something, they might have a little school room, half dozen people turn up, and they go home and say, yes, we consulted with the people of so and so. You see what I'm saying? They can't say they didn't do it,
Yes.
They did it in form, but not in substance.
Yeah.
And this is where we, the people, we, the citizens, have to take these consultations and consultations seriously, because they do matter.
They do matter. They absolutely do matter. They absolutely do matter. So,
We don't get the money anymore if we don't have the stakeholder consultations, you know. But oftentimes they take place and people say, well, oh, what did that mess up? I have no clue what happened. Some
Yeah.
communities are well organized and get the resources. Some communities, somebody tick the box. In other words, they are flyover or drive-through communities.
Yeah.
They don't get the attention.
That is really sad. That is really, it's like squeaky wheels get, the squeaky wheels get the oil.
Absolutely.
Right.
And
Right.
it's not a block road business, you know. You'd be
Yeah.
surprised when a community has an articulate advocate and they
Yes.
speak on behalf of the community, and they can mobilize signatures, and they can mobilize meetings, and they can ask people to come to town halls. Nobody, knowing that a town hall will have 50 people, is going to say no and don't come. The MP will come, the council will come, the head of the agency will come, the superintendent of the police will come, because they fear not coming.
Okay. All right. Well, communities, here. So I know time is going. It's already 7:30, but I have one more question for you. Okay. So you're very deep in Jamaican culture. A lot of persons don't know that you're also co-author of the book Reggae Roots. And of course, you also spoke about healthcare education and being able to be creative enough to capture even if it's a 2-minute attention of the people. So how do you, and also the CEO for Bellevue Hospital, I've been watching some of her TikTok skits, right? So how do you think we can better leverage our culture to deliver meaningful healthcare education?
We have to have ongoing conversations around healthy living. I start off by saying the incidence of NCDs is rising. The incidences of untreated mental health issues is rising. And especially since we have had the trauma of a pandemic, which we have not fully resolved, or should I say, had not fully resolved when we had Hurricane Beryl, Tropical Storm Raphael, and then an unprecedented hurricane in Melissa. We are still traumatized, even if we don't know it. We walk, we smile, we get on with our lives, but we are losing our sleep. We are deeply traumatized. Our children are not learning the way they ought to. So we know these things. You pointed out what the CEO at Bellevue is doing, and she's doing a terrific job. She's a bit of a rogue in terms of doing it on her own. I think we need to learn what has worked effectively in her case. And not everybody's going to be a media star personality like that. But it is clear by all the studies in different media, different messaging, that Jamaicans respond to short videos.
Yeah.
We need to get that positive and healthful messages out there, because there's a parallel risk. There's a lot of misinformation and disinformation on the short form videos out there, steering people in the wrong direction. So if we do nothing, we're going to be in trouble. So we need to really put on our running shoes now and really move very, very quickly with this. And this, as I say, coming back to my thing about social dialogue and stakeholder engagement, we need to have a voice in it. And the most effective short form videos are from trusted people.
Yes.
And their message is not going to cut much dash. People, after a while, they just get bored. They hear the same old voice, they see the same animation. But if they were to hear, and you see, I don't want to age myself, I have to think of who is the, you know, Spice has passed 40, but she's still relevant. But,
okay.
Spice, I'll tell you a little thing, because I can share that we are both past students of the Great Caribbean College.
Purple Power.
A few years ago, the head of the PTA came to me and said they wanted to organize a benefit concert. And they did a poll among the students and the teachers. And this was several years ago. And they said, "What, Chinsia?" I said, "Are you sure?" Anyway, they got Chinsia. She did a very clean act.
Yes.
Cost a ton of money for the shot. At the time, it was about $500,000 for a little half-hour appearance. But PTA made a ton of money. So I was there saying, really? She said, that really don't sound like, but so at the risk of showing my age, yes, there are very persuasive dancehall artists, including Shensia, who has done some messaging for this kind of lifestyle. I mean, she's a great cook and all of that. But you have even younger, newer stars. I know Valiant did something recently for public health care, I think,
Okay.
but there are others because they come up at you very, very quickly. My daughter was telling me about Skipper. I had never heard of Skipper. I never heard of Governor. I never, as I say, I'm sure I have to check with the youngsters to say who is hot and relevant.
Yes.
So I say this pointedly around our dancehall artists because they have our young people. And
Yeah.
I am with it enough to know that Massacre had a Hill and Gully rhythm, song on Hill and Gully rhythm, but we can't play it because some of the lyrics are too X-rated for all man.
Uh-oh.
But the fact that they could revive a mentor rhythm and find popularity across generations, across years, says
Mhm.
that music and our musical artists are still the most powerful messengers. But
Yeah.
restricted to them. There are other credible Jamaicans who can engage in the message. But the musicians and the artists, I think we should mobilize them. And I know there's a tremendous goodwill in that community. We have to be careful because what they are scared of is politics. They don't want to feel like they are being used to promote a political cause. So we
Mhm.
have to find, as I said, this is where social dialogue becomes important because social dialogue rises above politics, brings together the political parties, communities, and so on.
Right.
This is bigger than us fighting at election time. This is healthfulness we're promoting to Jamaica. So what would I love to see? I'd love to see Massacre on the Hill and God really do a duet with Spice and maybe we train an old school guy like a Shaggy or a Sean Paul. And
You call Shaggy and Sean Paul old school?
they're very old school.
I think they're still so very relevant.
They are relevant, but they are 30 years, in the
Yeah.
business.
Yeah.
So
So
messaging, I would love to hear some health messaging on the Hill and God William. Playing back and forth about healthy lifestyles, making good choices, not driving so fast. I saw a CCTV clip from Portland yesterday. 2 cars racing and crashed into a building. We're promoting the wrong things,
yeah. Yeah. So we're is so I do understand your point about politics. Jamaica is highly, highly political. The least little thing, it seems to be political. For example, we sent out a flyer some time ago, and a person sent it back, commenting on the color of the flyer and what that may seem. And so the flyer was rejected, not because of the content, but because of the color. And so I do believe that instead of going from the head up, we may have to go from community
Have to.
up. And
And that's
so,
the thing, when you can organize 100 people and say, look, we need to see you, we're having a town hall meeting and so and so, and we want
yeah,
to discuss matters compared to so and so. It's more effective. So they've rolled back in so much anymore, because I'll tell you, people are getting sensible and creating petitions and online. Social media has become a very, very powerful tool
yeah,
when used for positive things. When you can make a short video of all the potholes in the community, people respond very, very quickly because and I'm not saying you must go out and do that, but
but it's a good idea. I'll be blunt about it.
first you put the music on it and you paint up some little things on it,
Yes,
or
of
create a
course.
little dance, the pothole dance, and they dance around all the potholes in the community. Make a joke of
Yes,
it. But the powers that be don't like to look ridiculous.
yes, yes. The bus can swim. Oh, Mr. Chen, it is such a pleasure speaking with you. And this brings us to the end of a truly enlightening episode. So many gems in this conversation, and I hope that our listeners will take it to heart. I hope it will get into the heart of the communities, and we can begin to see some organizing. And I'll put it out there. If you want help with organizing from the community level for health related reasons, you can always contact me. And if I need to call for help, I'll call for help, right? All right. And so, Mr. Chen, I just want to thank you so much for all these common sense, practical ways that we can take charge of our own health, and to advocate for ourselves as well. Not being wealthy doesn't mean that we can't experience good health care, as you've explained to us, but just utilizing the resources that are made available to us, the know your numbers or annual checks, you know, getting collaboration with other agencies so the old folks can get sleep at night, not right, and really being concerned about the quality of health for the elderly in our community so that everyone can participate. And of course, I'm going to tag our Honorable Prime Minister and our Minister of Health. Of course, I know they are very concerned about the country right now, and they've pledged themselves to the country, and we look forward to working with them from a community level. Mr. Chen, how many thank yous can I give to you? I really appreciate you so very much. Thank you very much for your time with us today. And until then, we'll see you next time on Conversations with Carrie.
Take care and thanks for having me. It was a pleasure.